Hello everyone, welcome back to my channel. Today we are talking about something very important but often misunderstood, HPV, which stands for human papilloma virus. Many people have heard this word but they don't really know what HPV actually is, how it spreads, whether it causes cancer, and most importantly, how we can prevent it. So, please watch till the end because this information can literally save lives. HPV stands for human papilloma virus. It is not just one virus, it is a group of more than 200 related viruses. Some types cause skin warts, genital warts, and some high risk types can cause cancer. HPV is actually one of the most sexually transmitted infections in the world. Many people will get HPV at some point in their life, even if they have only one partner. The shocking part, many people don't even know they have it. HPV spreads mainly through skin to skin contact, sexual contact, genital contact. It does not spread through sharing food, hugging, toilet seats. Oral HPV can spread through oral sex, deep or open mouth kissing, or even close intimate contact. Can kissing spread HPV? Yes, but the risk is lower compared to oral sex. Studies show long term deep kissing with multiple partners increases risk slightly, but most people clear the infection naturally. Low risk HPV. These cause genital warts, oral warts. They are uncomfortable but usually not cancerous. High risk HPV. These are more serious high risk types like HPV 16 and 18. Can cause cancers such as cervical cancer, oral cancer, throat cancer, anal cancer, penile cancer. High risk HPV and oral cancer. HPV, especially HPV 16, is strongly linked with oropharyngeal cancer, which includes cancers of tonsils, base of tongue, and throat. HPV infection in the mouth doesn't usually cause symptoms at first. If it persists for years, it may contribute to the development of SCC in the oropharynx. This form of cancer can cause symptoms such as persistent sore throat, difficulty swallowing, ear pain, or lumps in the neck. Some of them are benign warts or papillomas, condyloma acuminatum, and cancerous changes. This is the squamous papilloma, which is benign. Small wart like growths inside the mouth or on the lips often have a cauliflower like or rough surface, as shown in the picture in the previous slide. Usually caused by low risk HPV types like HPV 6 and HPV 11. It can be removed if bothersome. Next one is condyloma acuminatum, HPV related wart. Larger soft lesion sometimes found inside the mouth or throat. Less common, but it is associated with HPV infection. Low risk types cause this disease. Next one is oral HPV infection changes. Some HPV infections show no visible signs at all. Lesions may be hard bumps or small warts, sometimes even painless. How oral HPV is diagnosed? Most oral HPV infections have no symptoms, so they are often found accidentally during a dental or ENT checkup. Clinical examination. A dentist or ENT doctor looks for wart like growths, white or red patches, non healing ulcers, which is present for more than 2 weeks, and lumps in the neck. HPV testing. Unlike cervical HPV, routine oral HPV screening is not common. Testing is usually done only if cancer is suspected. Biopsy confirms malignancy. HPV, especially type 16, is strongly linked to oropharyngeal cancer, which affects tonsils, base of tongue, throat. Symptoms may include persistent sore throat, difficulty swallowing, lump in neck, ear pain, voice changes. The scary part, these symptoms appear very late. That's why awareness is very crucial. Yes, in many cases, the body clears HPV naturally within 1 to 2 years. But if high risk HPV stays in the body for many years, it can slowly cause abnormal cell changes, which may eventually turn into cancer. That is why regular screening is important. For women, PAP smear test, HPV DNA test should be done. The good news is that HPV is preventable. Prevention is by HPV vaccine. The vaccine protects against high risk strains, especially HPV 16 and 18. The most common vaccine given is Gardasil 9. It protects against 9 HPV types. Recommended ideally before sexual activity. It can be taken up to age 45. It is given in 2 or 3 doses. It significantly reduces risk of cervical cancer, oropharyngeal cancer, and genital warts. What does it protect against? It reduces the risk of cervical cancer, oropharyngeal cancer, which is also called as throat cancer, anal cancer, and genital warts. It does not treat existing HPV infection, but it prevents future infection. It is available in India in major hospitals, gynecology clinics, and even in some government centers. HPV vaccine protects against the most dangerous types of HPV. One commonly used vaccine worldwide is Gardasil 9. So, as I already told, it protects against HPV 6 and 11 warts, 16 and 18 cancer causing, plus 5 additional high risk types. So, all 9 types. Its side effects of the vaccine are usually mild, injection site pain, mild fever, headache, fatigue. Serious side effects are very rare. Who should get it? Usually, boys and girls ideally between 9 to 14 years. It can be taken up to 26 years, in some cases, even up to 45 years after medical advice. Doses required if age 15 or older, 3 doses. First dose is given, the second dose is given after 2 months of the first dose, and then third dose it is given at 6 months. If younger than 15 years, 2 doses are given. The vaccine is safe, tested, and approved globally. It does not cause infertility, it does not promote early sexual activity, it simply protects your future. Some myths and truths about HPV is that one of the myth is that only women get HPV. Truth is men and women both can get it. Another is if I don't have symptoms, I don't have HPV. Truth is that most HPV infections have no symptoms. They have no symptoms, and the myth is that HPV means cancer. Actually, most HPV infections never become cancer, they can be prevented. Few things to know about HPV. So, most oral HPV infections do not turn into cancer. HPV 16 and 18 are the strains most linked with oral cancers. Vaccination can reduce risk of high risk HPV infections. Early detection by a dentist or ENT specialist improves outcome. Persistent or unusual lesions in the mouth should be evaluated medically. Don't worry, HPV is common, HPV is preventable, and HPV related cancers are largely avoidable with awareness and vaccination. So, please get vaccinated. Encourage your siblings and future children to get vaccinated. Do regular screening. Don't feel ashamed to talk about HPV. Talking openly saves lives. If this video helped you, share it with someone. You never know who might need this information today. Thank you for watching. Stay informed, stay protected.